So let's start. Very welcome to this patient safety conference in Sweden, in Europe, and even the world, because we have the presence these 3 days coming, not only today, but tomorrow and also on Wednesday. Together we will have people from 19 countries. Isn't that something? So, yeah. My name is Penilla Gunther. I'm the founder of this meeting place. We used to call it for life science and healthcare. And we are very proud and honored to have different kind of collaborations all over the world now. And we're starting today with the European Patient Safety Foundation. And I will leave the floor to Sven and say a few welcoming words just until we will listen to our keynote speaker. Very welcome, Sven.
Thank you. I think I can take this microphone, can't you? Yeah, okay. Good morning, everybody, and welcome to this conference on patient safety together with FOKUS Patient and the European Patient Safety Foundation. My name is Sven Staender and I'm from Switzerland. Yes, Switzerland, not Sweden. And my first name may suggest something else. But I flew yesterday for 2 hours between Switzerland and Sweden before I crossed the border to Sweden. So we are pretty far away from each other. But when you are looking on the internet and you order something online and you go down this scroll down list when you have to enter your country of origin, you must be very careful not to select Switzerland and Sweden or Swaziland, obviously. No, it's great to be here. Thank you for organizing this, Penilla, for all the work, and Mirka from the foundation. It's wonderful to be here at this conference, in this wonderful hall, in this city. I love sailing in the archipelago, so I know a little bit of your country, and I love it very much. Yesterday I sent a picture to my son flying over Stockholm, and he said, "Oh yeah, I remember, I remember." So, we're talking about safety today, a lot of safety. And before we talk about safety, I would like to talk a little bit with you about basketball. Basketball. I played basketball when I was a couple of years younger. And basketball is a fascinating sport. You probably know there are the National Basketball Association in the United States, and there are really famous players there. And in basketball, you have a lot of statistics. And one of the statistics goes about scoring systems. And a friend of mine from the University of Toronto came up with this idea, so it's not my idea to make this analogy, but it's his idea. It's Brian Goldman. And he said, looking about the statistics in basketball is very interesting, because there you have the so-called three-point limit, that is 7 meters away from the basket. And you have players in the National Basketball Association that are so-called third-tiers. The third-tiers are those players that in 3 out of 10 times safely score when they pull on the ball to the basket. These are the third-tiers. How are they called, the third-tiers? They are good, really good. And then there's a group of the fourth-tiers. The fourth-tiers, they safely score in 4 out of 10 times. How are they called? Legions. They are really the legions. Stephen Curry, Kareem Abdul-Jabbar, Michael Jordan, you all know these names. They are the legions. Score 40. Okay, now go back to medicine. I'm an anesthesiologist, an intensive care physician, so I feel a little bit safer talking about medicine. And imagine now you have to have your gallbladder taken out. And you are referred to a surgeon who is a 4th-tier on gallbladder removement, gallbladder surgery, a 4th-tier. He's a legion in basketball. But would that be enough? Or imagine you are in a remote location and you have to have coronary surgery or coronary angioplasty. And your cardiologist is a 20-year. Okay, compared to sports, he improved a little bit and he's on his comeback trail. He's now a 24er. It's not enough. It's not enough when we compare it to medicine. What should a surgeon, what should a paramedic, what should a nurse be? Obviously, a 100er. Everything else we would not accept. And that's a big challenge for us. Because on the one hand, we know that we will never accept errors in healthcare. And every error we make and every mistake we make is one mistake too much. Because it leads to harm, it can lead to a huge personal catastrophe and tragedy. So every error must be avoided. But on the other hand, we must be aware that we are human beings dealing with human beings. So to think that we can expect 0 errors in healthcare is a big problem. I know that we should aim for 0, but when you expect 0 from all of our colleagues, it's very difficult. We train a lot in healthcare. I learned so many details. I learned all the branches of the carotid artery, the complete differential diagnosis of renal insufficiency. I'm going to the simulator to do my skill training and my team training. And despite all that, I know that I will make mistakes. And I already made mistakes. But society will not accept that we are making mistakes. And this pressure on the healthcare system is a huge pressure. And it's not only a pressure, but it leads to the topic and the problem that we are not used to talk about errors, because we do not accept that errors will happen in healthcare. And this dilemma between 0 defects and the request that we shall not harm, because we had an oath that we swear when we go into medicine that we will not harm our patients. Yeah. This is a huge dilemma in healthcare. And that is also the reason why we distinguish between the error culture and the safety culture. When I started dealing with safety, it's now some 25 years ago, we were talking about error culture. And I think on the one hand it was okay to talk about errors, but now we are talking about a safety culture because we surely want to avoid errors, but more we want to focus on safety. We focus on the positive aspect. So we must take every effort to avoid harm, and that includes patients and also the healthcare workers. And the European Patient Safety Foundation strongly believes that we can improve safety in healthcare through people-driven, collaborative, sustainable approaches. And this is the overarching topic of our conference. And look at the logo of our foundation. One of the hearts that we have in our logo is the patient. The other 3 are all the other stakeholders, healthcare workers involved in safety. So we can only do it together, patients and healthcare workers. But now I would like to introduce our keynote speaker. It's Dr. Neelam Dhingra. Dr. Dhingra leads the safety efforts of the World Health Organization, and she started working for the WHO already more than 20 years ago when she first was working on the strategy of blood transfusion safety, a topic that she covered for more than 10 years. She next was responsible for the coordination of patient safety and quality improvement before in the year 2020 she became the head of the patient safety flagship unit at the WHO. Ladies and gentlemen, please give a warm welcome to Mrs. Neelam Dhingra.
Thank you very much, Sven, for that introduction. Hello and greetings from the World Health Organization Geneva colleagues. I'm truly honored to be invited to speak at this very important event, and my sincere apologies in not being able to join in person. First of all, I want to congratulate the FOKUS Patient Initiative and Dr. Penilla Gunther, founder and program director of the initiative, and the European Patient Safety Foundation and President Dr. Sven Staender for organizing this International Patient Safety Conference as part of the global celebration of World Patient Safety Day. This event particularly recognizes the vital and central role of patients and families in the safety of healthcare, not only for their own safety, but also their key role at the organizational and at national level in leadership and governance. Additionally, they also significantly contribute and even drive the process of policy formulation and implementation in many countries through national patient action plans, by demanding access to safe care as a patient right. I'm truly impressed with the excellent program of the conference with wide-ranging agenda items such as National Action Plan for Patient Safety at all levels in the healthcare system, the need to involve patients in the decision-making process, safety culture, as was mentioned by Sven, and also the healthcare safety and patient safety are the two sides of the coin. So for this keynote, I would like to share a few slides to scope the issue and also about the WHO Decade of Patient Safety and how we work at the WHO for patient safety, and also about the annual theme of this World Patient Safety Day. So if I could have access to, just like to share slides. So when we go to a healthcare service, we expect to be given, safe care, and we don't expect to be harmed. Never even we think that we'll be harmed. We just presume the care is safer because it is so fundamental. However, when we aim for no one should be harmed in healthcare, there's a huge burden of unsafe care globally in the healthcare system. Adverse events are likely one of the 10 leading causes of death and disability worldwide. Even in high-income countries, 1 in every 10 patients are harmed while receiving hospital care. And in the low and middle-income countries, estimates suggest that every 1 minute, 5 patients die because of adverse events. It's a huge burden of harm which happens, which is avoidable. So political leaders around the world have recognized this challenge of unsafe care and avoidable patient harm. And I'm sure you're fully aware of the global patient safety movement from 2016, when the annual Global Ministerial Summits on Patient Safety were initiated under the political leadership of the UK government and German government. And they have been successful summits organized in the UK, in Germany, in Japan, as well as in Saudi Arabia in respective years. And I'm sure you're fully aware that the 5th Ministerial Summit on Patient Safety, which was supposed to be held in 2020, is now going to be held in February 23 in Montreux in Switzerland. WHO leadership has been at the forefront working with these countries who have taken up as their commitment to global patient safety. This global commitment of ministers from around the world through ministerial summits led to adoption of a landmark resolution in May 2019 through the World Health Assembly on Global Action on Patient Safety. And the Assembly also recognized patient safety as a global health priority, established an annual World Patient Safety Day on 17 September as one of the WHO mandated global health days, and also invited international organizations and all stakeholders to collaborate with member states and countries in promoting and supporting patient safety initiatives, and requested DG of WHO to formulate a global patient safety action plan aligned with the Sustainable Development Goals till 2030. So taking this forward, the WHO program on patient safety worked with partners and stakeholders and member states from around the world for 2 years. And in 21 last year, in May, at the Assembly, a decision was adopted by the World Health Assembly adopting the Global Patient Safety Action Plan, which is a roadmap for next 10 years towards eliminating avoidable harm in healthcare. And as our previous speaker spoke about, that zero harm is a vision We may or may not be able to achieve it, but it's a direction we have to really keep in mind, because even one patient harm is too many. In addition, the decision of the World Health Assembly also requested WHO Director General to report back on the progress of the implementation of this action plan. And so the first report to the World Health Assembly would be in May next year. And this action plan, after the adoption by the World Health Assembly, was officially launched by the WHO Director General, Dr. Tedros, in August. The vision of this action plan is a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. And I'll briefly touch upon some of these strategies which have strategic objectives which have been defined in this action plan with the goal to maximize the possible reduction in avoidable harm due to unsafe care globally. So the action plan has a 7x5 strategic framework, 7 strategic objectives, and under each of these, there are 5 strategies. And I will just go through some of them. So policies for zero patient harm as a mindset, as a direction, as a vision. High reliability systems, in particular, applying human factors. Safety of clinical processes every time, everywhere. Patients and family engagement, health worker education, skills and safety, information research and risk management and improvement, and synergy, partnership, and solidarity. So just go through the 2 of the strategic objectives, which are very relevant for today's discussion, is on patient and family engagement, to engage and empower patients and families to help and support the journey to safer healthcare. And it has some key strategies, which are for co-development of policies and programs with patients, learning from patient experience for safety improvement, building capacity of patient advocates and patient safety champions, patient safety incident disclosure to those who have suffered harm, and also education, information of patients and families to enhance the health literacy. On the area of health education, health workers' education, skills, and safety, to inspire, educate, skill, and protect health workers so that they contribute to the design and delivery of safe healthcare systems with patient safety and professional education and training, centers of excellence for patient safety education and training as well, patient safety competencies as regulatory requirements, linking patient safety with appraisal systems, and also safe working environment for health workers. So to take forward WHO's role in the Global Patient Safety Action Plan, and as a commitment and response to the global call for action, WHO launched a flagship initiative, which is the Decade of Patient Safety, aligned with the Global Patient Safety Action Plan. And it has several components, but I just want to share this as a brief overview of what we do in WHO. As you know, WHO has headquarters in Geneva, has 6 regional offices, and as well has 150 WHO country offices. And we work with partners and member states, particularly because it's a member state organization, and also work with all international organizations and stakeholders in relevant stakeholders, particularly patient safety being so integral to healthcare system and healthcare delivery. Every organization who's working on health-related issues is our stakeholder. So these are a couple of important initiatives and programmatic activities which we do, of course, World Patient Safety Day, facilitating and developing a campaign and working with countries to maximize the impact of World Patient Safety Day, implementation of the Global Patient Safety Action Plan going forward, and also reporting to the World Health Assembly every 2 years for next 10 years. And then the challenge on medication without harm, WHO has an initiative on global patient safety challenges. Clean care is safe care was the first challenge. Safe surgery saves life was the second challenge. The third challenge, which has been given to countries to prioritize, is medication safety and achieve medication without harm. Global Patient Safety Collaborative as a mechanism to work with the low and middle income countries to develop patient safety systems, and also interactive global patient safety networks, not only for healthcare professionals and partners, also for patients. So we have in the area of patient family engagement, we have a patient for patient safety network as well, which brings together families of those who have been harmed in healthcare and those proactively who would like to contribute to bringing patient voice on the table. In addition, WHO Patient Safety Flagship also works on developing standards and guidelines and tools. And what you see in the picture is the reporting and learning guidelines, which WHO launched just 2 years back. Just in the month of August, we launched a report on a rapid review on implications of the COVID-19 pandemic for patient safety. This publication particularly has been developed in our build-up to the next ministerial summit in February next year, and it has been developed actually in collaboration with the Swiss government. And this report emphasized the high risk of avoidable harm to patients, health workers, and general public, identified a range of safety gaps across all core components of health system at all levels, also explored the impacts of COVID-19 pandemic on patient safety, particularly in terms of risk and avoidable harm, and specifically in terms of diagnostic, treatment, and care management. And we followed the main patterns of these implications within the broad healthcare system. So this report is available, was launched in August this year, and which basically gives an overview of where things went wrong. We are now working on a phase 2 of this report, which is about how do we mitigate these risks and risk of harm, and also what member states and countries would need to put in place if faced with similar situations. So just a few words about how do we work in WHO. So our patient safety flagship is primarily constituted to implement the resolution of the Global Action on Patient Safety and the Global Patient Safety Action Plan. And the patient is actually at the center, and with health workforce and organizational procedures and policies, and also the conducive environment to perform in healthcare system. And the several approaches which we take is leadership, policies and strategies, which working with countries, guidelines and tools, capacity building and technical support, collaboration and partnership with all stakeholders, measurement, and also research and evidence. And all this research and evidence then contributes to developing policies and strategies which are evidence informed. And the direction we have is all these approaches will then ensure we aspire to improve patient safety, reduce the risk of harm, achieve better health outcomes, enhance patient experience, and lower the cost of care provision, which is safer care to the healthcare system. So moving to a few words about the World Patient Safety Day, which was, as I mentioned, established in 2019 by the World Health Assembly. So it's a mandated day, and this was the 4th time we observed the day. And each year there's a theme which is selected to focus on the area where there's major harm, and also there are proven strategies which need to be put in place. Just as we are discussing today on the health worker safety issues as well, I must say that 2020 World Patient Safety Day, when we were coming into the COVID pandemic, when it was folding out and affecting all countries around the world, that was the time when health worker safety as a priority for patient safety was selected as a theme. Extremely successful campaign reaching to member states and partners, and WHO launched a charter on health worker safety, a priority for patient safety, which outlines all the key actions which need to be taken by different stakeholders, and also launched World Patient Safety Day goals on the theme of health worker safety. This year, the theme is medication safety, and medication errors and harm accounts for 50% of avoidable harm in medical care, which is a huge burden of harm. And more than half of it actually comes from medications. Medication errors and unsafe medication practices are one of the main causes of avoidable harm, and huge financial losses occur because of medication errors. There's high rate of avoidable harm which occurs at 3 stages of medication use process: at the prescription stage, administration stage, and also monitoring stage. However, throughout the medication use process, there are risks of harm which need to be addressed. WHO has developed a strategic framework and key action areas to focus on as part of the Global Patient Safety Challenge on Medication Without Harm, about which I mentioned earlier. And this was launched at the 2nd Ministerial Summit in Bonn, Germany in 2017. And we've had some focused action on the area of medication safety. However, because of the COVID pandemic, in many countries, action related to medication safety was put on hold because of limited capacity and not really getting the priority what was required at that time. And we did develop several tools and guidance, but they were not really implemented. And we are really hoping that with the World Patient Safety Day theme of this year, we can consolidate and call for more focused action and accelerated response from countries. Just briefly about the strategic framework. This actually identifies 4 domains where action is required to strengthen medication safety systems and where major foundational problems occur. Patients and public, their understanding of medicines as products, particularly the look-alike, sound-alike medicines, healthcare professionals' role, as well as systems and practices of medication and the entire medication use process. So just on the elaborating on the key areas where interventions are required to strengthen medication safety systems, patients and the public, the awareness and medication literacy, engagement of patients, reporting by patients, and involvement of patient organizations. And for healthcare professionals, education and training on medication safety and medicines, understanding the medicine they are prescribing, communication and teamwork, capability at point of care, and also incident reporting and learning to learn from errors and harm. And 3 key action areas where most of the harm occurs, we're asking countries to prioritize those 3 areas: high-risk situations, which also include high alert medications, polypharmacy, and transitions of care. We have given this campaign, which has been developed for World Patient Safety Day, no check ask for healthcare professionals and for patients before you give it and before you take it. And you have to know, check, and ask. And also the 5 moments of medication safety, which is an extremely important tool for patient engagement with the health professionals. So we really hope that the campaign of this year can enhance the interaction between health workers and patients through the No Check Ask campaign and also through the tool 5 moments of medication safety, which runs with the mnemonic starting stars, which is starting, taking, adding, reviewing, and stopping. So just a few glimpses of the success of the World Patient Safety Day this year. We have informally collected a report from public domain on the web, and we have almost 125 countries who are reporting that they observed the day. More than 300 iconic monuments were lit up. This is the one from Malaysia where the palace was lit up, and the Jeddah in Geneva was lit up as well, and the world really turned orange on 17 September. So we really believe that the global solidarity provided by World Patient Safety Day will increase the engagement of public and patients and also enhance the understanding of patient safety. So with that, I would like to again thank you for this opportunity. Join us in achieving medication without harm. Thank you so much indeed.
Thank you, Neelam, Dhingra. It was a pleasure listening to you, and I want to congratulate you and your work in the WHO, because from my point of view, you really made a huge difference when it comes to the visibility of the problem of patient safety. So thank you very, very much for this effort. I think this is so important, because when you compare it to other topics in healthcare, which are obviously very important to cancer medicine, diabetes also. Patient safety for a very long time was a little bit in the shadow of medicine, and you realized to put it into the focus and the spotlight, and I would like to thank you very much for this effort. Thank you.
Thank you very much indeed. Really wonderful to connect with you, and I look forward to meeting in person as well. Thank you so much. Thank you.
Thank you so much, yeah, we really do looking forward to meet you here in Stockholm some other time. But thank you for your time, Dr. Dhingra, and once more a hand for the patient safety as your big and very important area that we will discuss today, and your introduction to that. Thank you so much.
Thank you so much indeed.
So, Sven, are you looking forward to the Swedish fika?
I don't know what it is. What is the Swedish fika?
Ska vi introducera våra utländska vänner till svenskt fika? Jag tror nämligen att alla sitter och längtar efter kaffe. Kan det vara så? In Sweden, you know, it's very important with fika. You need to have some coffee, of course, and you need some cookies or maybe some sweet. So we will, after this fika, we will have a coffee break. Of course, it's the same as fika. We will have parallel seminars, and I would like to be a bit practical here, because we have had to change the room numbers. So if you look into the program, you will be a bit confused, and 362 is now 357, but it's not that big, so you don't get lost in here. You will see where the seminar is. But please, do not enter just one of the seminars. Spread out so we have an equal amount at least for every seminar, because everybody will have something very interesting to listen to, and I do think we will have a great day together here with all. I think we have nearly 40 speakers, and of course all of you attendees who will ask questions. I hope to be interactive and really be a part of this day. I believe in seminars and meetings, conferences, because there are meeting with people, and to interact with other people, it always gives joy and new insights and knowledge. So please go out and have some Swedish coffee, fika, and enjoy yourself with that and each other, and mingle around, and we'll see you again at the seminars 10:30. Thank you.